This is Akashvani, Kohima. A very good afternoon to all our listeners. You are listening to the station of the region at 100.3 megahertz. Listeners from Mallory, Shamator, Dimapur, Tening, Mon and Twinsang, you are tuned in with me right now at 100.1 megahertz. Listeners from Mocha, you are tuned in at 101.8 megahertz. Listeners from Peak, it's 102.1 megahertz. And listeners from Zeniboto, you are tuned in to this program, Akashvani Kohima, at 101.2 megahertz. Once again, I would like to welcome you all to our program, Drug Free Nagaland, a live interactive bilingual program initiated by the Regional News Unit Akashvani Kohima in collaboration with Nagaland Police Department and other agencies. So my dear listeners, once again, Abdihan Sobke welcome Kuridia say this is an ongoing series and we have had really interesting panelists in our program in the past, and even today we have experts from different fields who will be sharing their insights, their knowledge. So we are expecting to learn plenty from them. So my dear listeners, Kwanishna to it program to interactive program say so you can write into us at 943680533. No chat tinche achune panch tin de apnihan message kurigina apnihan queries takishe question takishe kiba hudule munjaya se ajila experts kange. You can definitely write to us by using the code FM space F, and don't forget to write your name and the location from where you are writing. As I've been mentioning in our program, that this is a discourse that we need to have as our own society is plagued with drug abuse. So my dear listeners, in this series we have been continuously dissecting every factors that contributes to drug abuse in Nagaland, whether it's from the medical point of view, Nohilebi police point of view, and others. We have been dissecting it, but one of the most important and one of the most significant area that we have to discuss is how aware our society is, whether our society is behind or it's progressing or it's ahead about drug abuse. So awareness la opore thakibole se ajila program. So the topic of today's program is how aware we are on drug abuse, and in our studio we have once again gracing us with his presence Dr. Sungtimen Jamir, Nodal officer, Project Rest. Thank you so much, doctor, for being with us again.
Thank you.
With him, we have in our studio Dr. Chubanungsang Imchen, who is the Joint Director, School Education Department. Thank you, sir, for being with us. And along with the doctors, we have Mr. Imosanen, Evangelist, Kohima Our Baptist Church. Thank you so much for representing the church and the civil societies. So without much further ado, we are going to get started with our discussion, with our discourse. So my first question, which I'll directly throw it to the three of you. Could you briefly share your experience and insights in dealing with individual affected by drug abuse in your own roles? Let's start with our doctor here.
So hi, thank you for having me back. My name is Dr. Sungtimen Jamir. I work as a medical officer in NHAK, Kohima, for under the capacity of a medical officer of the OSC Center, that is a opiate substitution therapy center, as well as a medical officer at the detox ward. Some of the experiences and insights dealing with individuals affected by drug abuse in my roles would be one of my key work is to assess and diagnose substance use disorders, understanding their factors contributing to their addiction, and also developing personalized treatment plans. We feel that is very important. I found that a comprehensive approach is very essential, both in physical and psychological aspects of drug abuse. This will include pharmacological interventions for management of withdrawals, and also psychological support such as motivational enhancement therapies, cognitive behavioral therapies, and relapse prevention strategies. They are usually administered by qualified personnel such as a clinical psychologist. We often collaborate with other healthcare professionals, and it is very crucial for providing a holistic care. We often work with clients to address and identify underlying issues such as trauma, co-occurring mental health disorders, or environmental factors that may be fueling their substance abuse. I feel this is almost very common among many people who are addicted or are dependent on certain or most of the substances. We also incorporate family support into our treatment plans, and we feel it is very essential for fostering a very sustainable recovery.
Itu pishi important topic ta amigan aji discuss ko bole ami ado amikan church prabe kapa Kohima Baptist Church prabe kushi pai ase aro listeners sob logo salom janai dia ase puila amikan church ami evangelist ikta idulaka kha logan nisha pani chis addiction la kha amikan sai dage experience ikta tamur pa do khalwa addiction ti dagan help lage motab lage ase motab bisari ase kuliwi motab na pauli tiktar bagina bisitu pagina buhi dage korde aro moi ekjon khai ase tawai khai ase modu khai ase tax khai ase kulido tai laga family sob tiktar di pagina thake aro itui nuina tai ishor logo relationship bi hatagina ishor logo relationship na thakigina thake aro itui nuina economically bi bisitu pagina tai gan laga families kan di jai shigulido morom thake itu dandi kut kiniga modu kore ase amigan church kan as a evangelist kiniga modu kore ase kulido tai gan logo chaigina motivate kore takibo motivate kore gina amigan Kohima di phalik tado NHK de Dr. Sungtimen ase to taigan NHK de refer kore dibo detox kore dibo iniga amigan motab kore take aro lakia kando amigan paratak rehab di refer kore take aro church di amigan our church laga ikta kapal laga phalik tado amigan taigan pishit dukhya manukan itu addiction rehab di chawli napari guli do amigan idukan motab kore take aro amigan ikta ami personal experience to काम करेगी ना आराम दिखता तंगोर एकता experience पादो मुरुम लगी ताइगा society बड़ा फिलान निशिना नि फिलाई भी फिलान निशिना भावना पड़ी ताकि ये तो बड़ा मुरुम करे ताका बड़ा अमेरिकन चाहिए ना मुरुम तो दिखा बोली कोशिश करे ताका ये तो टाइम थी ताइगा फाल बड़ा अमेरिकन लोगो response करे ना मोटो करे बोली तो open up करे ताकि तो ये तो अमेरिकन मुरुम करा ताकि base करे ना ताकि काम तो शुरू करे शी बोली तो relationship to phag negina aro major hi taigan bre amigan lesson to tower hikigina ikilogo miligina chata ka indonesia experience tower taigan lo kam kora tan di pa amiga indonesia ayase.
Thank you so much. Let's hear
Thank you,
Dr. Chubanungsang.
hello to all the listeners. Mula, I need to take that experience to work, but before I get into your question, I'd like to highlight a very important message or information regarding the school education department. So, as per a national survey conducted in 2019, this is a national survey, around 1.11 lakh students, they are using illegal substances in one form or the other. So, this is a very alarming scenario, and this has to be addressed in a very urgent manner. तो इतवान address करूले लगा तो ले तो की करूले लगे कोले तो education department तो we have coordinated with the health and family welfare department, which is mainly concerned with the school health programs in the schools. So usually we coordinate with the health and family welfare, and there are also other stakeholding departments like the social welfare. So to address this alarming trend among the school-going children, which is the future of our society. If 1.11 lakh students are using drugs as per this survey, out of a population of 18 lakhs only, our society is in for a big or very bleak future. So to address these issues, the school department, in our own capacity, we have been coordinating with the health and family welfare department. There are certain programs, for instance, INSEX is there. One of their primary focus is, of course, drug use, because it's directly linked to high prevalence in the HIV infection, which is also a very serious matter in Nagaland. Of course, as you all know, HIV is one of the highest in the world. Actually, globally, as per the statistics, HIV prevalence is one of the highest in the world, Nagaland, which is directly linked to drug abuse in Nagaland, especially IV drug users. So, regarding this serious matter, we have been collaborating with the concerned stakeholding departments, and there's so many programs. So, any example like that we give, any one government notification to school every morning assembly there, a topic on the harmful effects of drugs and the menace of drugs should be taken up in every assembly every morning. So we have sent those circulars to the schools, and teachers are taking up those topics in the schools every assembly hour. And right now there's a program called the Health and Wellness Program. So this is a collaborative program between the Health and Education Department and the School Education Department, where we have appointed around more than 300 teachers who are appointed as Health and Wellness Ambassadors. So these teachers especially have been trained to impart awareness regarding drugs. Drugs is one of the main topics which they impart on a daily basis in the schools. So those are some, in a nutshell, some activities which are going on in the schools.
So the department has been doing a lot of collaborative, as well as what the doctors have mentioned, that convergence program is going on. So on that note, I just wanted to ask you, since you have mentioned the survey, and that was in 2019. Yes. So, and the department is taking steps to address this alarming issue, and there have been various activities, various convergence program. Pichide progress, the result to balasna biasi to kinya jane. When is the next survey going to happen, or is there any numbers that the department is tracking? If you can
actually
highlight.
Now we are trying to strengthen the student data management system. Now with our present advisor, he's been quite interested in issuing these health cards. So on the health card, we have made it a priority that mental health screening should be done, which is very important because it's directly linked with drug abuse in the schools. So we're planning to introduce these health cards. So in these health cards, it'll be proposed that it will be linked with the STMIS system, student data management system, so that wherever the case of drug addiction or some students who are in need of help because of drug addictions or are at high risks, they'll be screened out in this format, which the Health and Family Welfare Department will be taking up. So it's a good idea to gather the survey koriye laga isapra data management into bank takibra we can at least get the concrete data of the numbers of students who are at risk or who are addicted to drugs. Inigal laga plan diase.
That is how you are planning to track the numbers. I think the numbers are also very important after a point. Yes. A lot of good work is being done by various departments. Stakeholders invest with time and energy and money, but I think numbers are what will show. So my next question is for Dr. Sungti. What are the most common misconceptions about drug addiction that you often encounter as a doctor, and how are they being addressed?
There are numerous misconceptions, but then I can only speak of those that I've encountered. One very prevalent misconception is that the belief that addiction or dependence on a substance can be easily overcome and can be put behind very easily. However, it is very essential to emphasize that addiction, particularly to drugs like sunflower, is a very highly chronic disease. Many individuals experience multiple relapses before successfully discontinuing the use of the drug. Even then, one can never declare himself as fully cured or recovered, because the risk of relapse remains a constant threat if they are not careful. There's another misconception that I want to address. It is that pills and injectables can only be classified as illicit drugs. This is entirely inaccurate. Especially the most common method of abusing the sunflower drug, which has gripped our younger generation these days, is through inhaling the smoke produced by burning the powdered drug, often on an aluminum foil. While we continue to display posters featuring syringes and needles on the street with anti-drug messages, it is very crucial for us to recognize that our children may be inhaling highly dangerous substances without fully grasping their potential risks involved. Apart from that, there are other misconceptions, and the belief that detoxification and rehabilitation are interchangeable. I think that is not the case. Detoxification is conducted by qualified medical professionals in a hospital setting, where they address acute symptoms of withdrawals, and then for a short period of time, maybe 2 weeks, 3. Then after that, we recommend individuals to undergo rehabilitation programs like our evangelist had said earlier, to specialized centers which are typically run by NGOs, and the duration of stay in rehab centers ranges from 3 to 6 months or even longer. And then I'm talking a lot, but then
No,
please
it's
bear
okay.
with
I
me.
think that is something that since this program is on awareness, apni kwanishna interchangeable ase guna bhabi jaina bishibar, but that is not it. As we have mentioned even in the previous episodes, that certain steps are mandatory. That has to be done. So we are quite happy.
And then there's also a misconception that addiction to drugs can be cured through extended period of stay at prayer centers. This is quite controversial. Let's see. That is very inaccurate, and it can be very detrimental to the person's recovery process. We encourage spiritual wellness for holistic recovery, but then the acute phase of withdrawal is best managed by qualified medical professionals at the hospital setting. Then after that, they can go to a prayer center or they can go to a rehab center. It's up to them, but that is the process.
Yeah, I think that is something that we all need to be aware of, because as I've said, no step can be substituted. Thank you so much for that. Doctor has also mentioned, but my next question is for our evangelist here. Since we know that Nagaland the church has a wider audience, congregation bishi dongor ase, so how can the church contribute in educating its congregation about the dangers of drug abuse?
American laga church ki kam kuri ase, kiniga awareness create kuri ase, etu olop koi dibo. Aro American our church to our Baptist mungdang. Tati bi ase to ito kan olop lamba korna koi dibo amina. American church awareness create kura do. American church de department alak signita pranchita ase. We call it Lifeline Ministry, purely dealing with drug abuse. American church or kapalaga itu alak last year bro kulikina itu bro motab koi lagi. So tadi itu laga under the Alcoholic Anonymous, really Narcotic Anonymous itu kan laga fellowship kulikina se. Tu taigan recovery di ahakan do lui jaigina American church lui lagi. Tu itu dende taigan laga testimony puli lagi, or taigan laga struggles puli lagi. So itu laga platform lui gina addiction to kiniga diktarasi awareness to koi lagi American. Aro congregation gan believers gan parata educate kori bole mon jai. Aro itu nisina taigan experience pro American iniga takise addiction to American iniga struggle kori takise. Aro itu biase iniga mutu probo lagi kwa taigan bro koi lagi. Aro American laga church de ekta do American committee alak ase. So American last year come ekta pura do Evangelist committee jaigina prathana korile manokan logo taigan logo educate kori dishe anigina mano professionals anigina taigan logo educate kori take educate kiniga taigan kotha korbo kiniga addiction du ki ase manu kiniga duk pai ase taigan logo open up kiniga kotha korbo idu educate kori take to idu nishina last year bro American itu laga program tu luigina taigan bi manu reach out kori take noile itu laga platform lugina church manokan do kiniga mudu korbo lagi kiniga diktarasi itu koi take aro ikta youth ko collaborate korina youth department ko ami ngala church under de aro education child department Sunday school department kanugo taigan program loa dandi ami gan awareness nina sensitize korina we topic ikta dibo taigan itu laga related de aro taigan we educate koi take. And one thing that we did last year was we call it primary prevention. Primary prevention do taikan nakha manokan noile nuchuakan aro start nokorakan pachakan do awareness itu aside kui take itu ita aro ami kam apamde ami social concern lagade community di apamde itu salbra ini member ita community member ita takabra ami kan laga program itu salaka ami kan church village level de church de urban rural area sabte miligina taigan logo council kan be church purani kina taigan logo kiniga educate kurdibo kiniga taigan logo itu hikai dibu laga plan program do banagina amigan chaya ase aro sooner amigan itu kan implement gurule addiction do itu aside iniga mutu pro lage de taikan ini necessary lagi de consequences to itu ase de relationally, economically, physically, spiritually, mentally itu consequences ase itu amikan hushar ko lagi itu laga amikan ini plan out kurina itu nisina itu jala ka time ase to amikan parada itu kan educate kurina itu laga platform lagina sensitize kurina possibility bole koshish kurina itu program kan do alak alak to lugina jai ase.
So the church is considering this issue seriously.
Seriously.
We have a dedicated branch
dedicated branch
to deal with it. So on that note, my question is, faith and spirituality contribute to rehabilitation. Doctor, they encourage spirituality, and medical professionals can handle steps that has to be done by a trained medical professional. But after that, faith and spirituality also plays a very big role in a state like ours. So itu the church be kiniga rehabilitate grace, if you can kindly highlight.
India, American detox program jayase. We call it men's special camp. So mutakan ni mede, aro itu bici the women's special camp aibo. American kapala ka program ita. Aro ikta itu bici de men's special program ita ase. To American coalition na physical withdrawal to manage korbo le American na parido. Coalition na itu bra American Dr. Sungtimen Jamir di medical team korna medical team kan bra detoxification du ase. To itu pichide American spiritual laga na holistic approach korina American psychologist kan bi mati kina ase. To taiga na gina mutu korbo. Olibi coalition spirituality American kinga focus kore ase bile to American taiga logo bhal bra puchai dia to. American physically to recover korole taiga American kujina thaka to aro Dr. Sungtimen bro je it's a relapsable disease kujina thaki ase. To anytime relapse korbo to aro mentally to tai mokosti to chagina ase to itu bra relapse korbole healing to recovery to itu na pare iniga American puchi di take will be American ikta pado physically mentally recovery no korbo will be spiritually to recovery korbo tai ishor logo connection take bolage ishor logo relationship take lido manu logo relationship take boli paribo aro tai ishor logo accountable take lido tai ikla take libe itu kon ahilibe tai accountable take boli paribo aro itu nishina tai recovery to sabuli paribo inia koi thake aro itu laga hikai thake American itia coalition American itia program jai ase spiritually tai kan prayer committee prayer group pra itia phathana koi ase to American coalition relapse prevention laga model de American tai kan laga evangelist committee prayer committee pastor kan inculcate program di haligina tai kan visit community thake aro encourage them motivate them na ishor logo connect korbole ishor logo restore relationship to koribole parise bole to manu logo koribole imani zero nichor bi interpersonal intrapersonal issues take it won't be ishor logo connect korbole parise bole tai nichor bi itu nishina healing babo itu laga American hikai de in line with Bible lugina anigina American taiga logo American withdrawal to lage itu to korbo lage itu manage korbo Olibi manu logo takigina chabule lagado ishor logo kani kornai chabule lagi do bra taikan tik muko sai gina do lagado ini nahaliti withdrawal bra bichite taikan recovery laga stage to sai gina amigan ishor laga kota do taikan ko buli para lagado itu nishina motivate korina hali thake.
I think that is very encouraging. The church is hand holding Korea do the whole process to. So as Abni mentioned Krishi last year bra ini the patients or should I say the beneficiaries can IS na itu an success rate kini ga ase
ami ekdom kushi ba do last year ami kan November October ilushe last man special camp to taikan kujina takado pichu naije 20 of them core manukan family members pro takado new year in between new year Christmas new year do taikan 12 Shundo, Christmas New Year Mutu Nakaina Bishi. That is a success story. Aroidia Manokan American Luginado clean Daka. Of course, lapse with again, lapse with again, will be Tagan Manolo Puchina, church will contribute to Kushishura, Dunishina Takero, Palikado, success story Lado, Tagan last year, December, October Moina di Luamano, Ichun Bra, Tagan Itia Detox Game Day. Taikan 5 June nishina taibro lukina. That's a great success story. To do nishina taikan ekta dai pawa parni motivate kurina junishina modappai.
Can I supplement to that? This Lifeline Ministry, it started last year, but this detox camp, men's special camp, has been ongoing for more than 10 years. More than 10 years. So just this particular wing of Lifeline department in the Kappa Church, as per my understanding, started last year to dedicate their service solely for drug addicts or alcoholics. But then the church has been taking care of without this Lifeline, they have been taking care of the alcoholics and people who are addicted to drugs for nearly 10 years.
More than 10 years.
More than 10 years.
11 years.
I think I have also come across a lot of detox camps being organized by the church in various villages as well, not just. So thank you so much. That is a wonderful information for all of our listeners. Kumba organizations can be, in case if they want to organize such experience, even the church can also handhold them, not only the people who have been using. My next question is for Dr. Chuba. From an education standpoint, what are the initiatives that are in place right now to create awareness of drug abuse among students as well as parents and teachers, if you can?
Actually, as I've already mentioned, we've already been having some initiatives with the health and family welfare. And as far as the education department is concerned, so for counseling, actually it's a very important aspect of approach in terms of drug treatment or drug awareness. So to counteract all these social issues, one being the drug awareness being one of the main components of it, under the Samagra Shiksha, this is a flagship program in the education department. Under the initiative, the SCT, they have already trained around 4 batches of mental health counselors in the schools. So these counselors, they have usually have been trained usually as a resource to be used for mental counseling or health counseling in the schools. So those programs have been, initiatives have been taken up by the school education department. And other than that, those health and wellness program is in place right now. And we're having adolescent education program is there in the health and family welfare. We've been coordinating with that program also. And they've been providing IEC materials to be distributed to the schools regarding the harmful aspects of drugs and the consequences. And of course, we are having close contact with the Nashamukt Bharat, which is being carried out by the social welfare department. So all these programs have been carried out to a certain extent in the schools at present.
Sir, as you've mentioned that many programs are being carried out in schools and all, but in order to build a nurturing, safe and secure environment for a child, I believe that even teachers and parents should be equally sensitized and aware. So is there any program specifically targeting the parents and the children? If any of our experts could address that, any specific program for parents will be, teachers will be, because takhan aware hule to bacha hange aware kori na. Do you think that's important? If yes, if there are any activities being or any program?
As far as the school education is concerned, usually these counselors, they have been trained to identify the students who are at risk, as well as get in touch with the parents, doing teacher-parent meetings and all that, to take up these issues in every. Annually, I think per school, there's 1 or 2 sessions as a parent-teacher meetings are there. So we encourage these teachers to take up matters regarding drugs issues during these meetings, so that the awareness is created and knowledge is imparted to the parents also.
That is something that we can explore more in the future, I believe, because disseminating of information to children, taki limited na kurina. I think it should go beyond that. Thank you so much. We are having a very interesting time here, but let's take a short break and we will be right back.
Don't get addicted. There are two
Welcome back, dear listeners. This is Akashvani Kohima at 100.3 megahertz, and you are listening to our live interactive bilingual program, Drug Free Nagaland, on the topic, How Aware Are We on Drug Abuse? This program is an ongoing series which is initiated by the Regional News Unit Akashvani Kohima in collaboration with Nagaland Police Department and other stakeholders. So, dear listeners, in our studio we have Dr. Sungtimen Jamir, NHAK Nodal Officer, Project RES, Dr. Chubanungsang Imchen, Joint Director, School Education Department, and Mr. Imosanen, Evangelist, Kohima Ao Baptist Church. So, my dear listeners, as we continue with our topic here, I just want to quickly remind you that you can send in your messages if you have any queries. This is a golden opportunity. Apni khan likhibole paribo at 9436805333 no char 36805 de apni khan la message to English, Nagamese, Kushibra likhi kina pathabi, and don't forget to write your name and the location from where you are writing. Our program is also broadcasted in our app, that is News on Air app. All you have to do is go to Google Play Store, install the app News on Air, and click on live radio to listen to this program. Another information that I want to quickly give out to our listeners is in all the programs, in all the episodes, I have been mentioning about Made in app de apni khan register korbole paribo. If you come across any person who is a trafficker or who is a transporter, but there is another information by the police department that any informers, if you inform about any trafficker, any transporter at the app, then you will receive a cash reward of rupees 1,000 per soap case. 1,000 per soap case. Or you can directly message them, DM them, or WhatsApp at 6909020229 6909020229 dibi WhatsApp korle parabo. Noilibi you can use the app Made in app or tadibi inform korle parabo. For every soap case 1,000 pabo. So if you chance upon anyone, then Kwanishna, you are being a responsible citizen. Along with that, you will receive a cash reward as well. And as always, your identity would be anonymous. It will be kept in secret. So with that, let me get started with let me continue with our program. Moving forward, I have a lot of questions here, but we have received messages from our listeners as well. So, itu messages to Purelu. This message is for our evangelist here, and this one reads, in your opinion, are churches of our state in general coming forward openly in advocating on the awareness of substance abuse and mental health? Also, in many cases, when a person gets into substance abuse, abusers are often directed or sent to prayer centers, Kwanishna, for spiritual intervention, avoiding professional help. So do you think such mentality should be changed among our people, keeping in mind that medical and professional intervention is very important?
Itu change probo lagi. Amihan itu lagi ase. Physical addiction to actually addiction dia focus korina boy ase. Addiction, especially substance abuse addiction la ado amigan doctor help to lagi withdrawal to bishi fatal ase. Kuno bado or bishi struggle kore concentrate korbole na pare bishi tok pai. Itu bra amigan parata amigan doctors medical help itu to lagi ase. Itu bichi di taigan mukos kan thik kaisi ahigina itu bichi di do amigan prayer center di holibi chailibi thiki ase holibi moila ka suggestion first medical help bisaibe draw manage korbole itu bichi de ishor la motop to lagi ase ishor la motop lagi ase medical help la to ishor la motop lea loan shina amigan bhavana korbo lage aru itu ishor brai amigan physical do puila amigan thik ahigina itu nishina to spiritual do amigan bhal bisari kuchi gule do itu hi sobse palwala itu hi amigan ঠিক যে লুহিনা যাবল লাগা এটো হি ভালা আছে আমি লাগা আন্ডারস্ট্যান্ডিং দুই আছে আৰু আমি লাগা কাম কৰাটো এটো লাগা বেস কৰিনা আমি কান লাইফ লাইন তাকম লিস লাগা do কাপা লাগা do তাতি বেস কৰিনা কাম do কৰিনা চাই আছে.
Thank you so much for that. Doctor bhi koi dishe, evangelist bhi koi dishe. There are certain steps And it's a lifelong process. Definitely, church will be, prayer center will be. Itula mudut lagi thaki bole ase to keep the motivation, to keep the fire alive. But Kwanishna, first step to medical intervention. My next question, the message that I receive is for Dr. Chuba. How is the school education department in Nagaland pursuing and dealing, and how are you identifying abusers when it comes to teachers? Kwanishna, bachahan kido mahan identify kore but teachers kan ke kina deal kore ase?
Regarding the teachers for using drugs, I think this issue has not been taken up because I think this is a preview of a police education department also, because there needs to be some investigative sort of procedure. And regarding teachers, so far we haven't come across any teachers who have had substance abuse, because obviously when such reports, if it comes to the department, then as per the rules of service rules, as per the government rules, these teachers will definitely be shown show cause notices. Later on, it might end in suspension, as well as maybe in the worst case scenario, termination. As far as the department is concerned, so far we have not received any such complaints from the public or from any other source that teachers are using drugs.
The rule is if any teacher, any educator,
if any educators they are caught, then obviously as per the service rules they'll be punishable.
Okay.
But as far as my experience, I haven't come across such complaints or from any source.
And as we have mentioned earlier also, the counselors working at the schools, they are also disseminating, they are also sensitizing equally the teachers and the parents. So thank you so much for that. My next question is for Dr. Sungti. Can you shed light on the current trends and challenges in drug abuse rehabilitation?
Yes, actually all the information in our possession is actually highly restricted, and we cannot disclose it without prior authorization from a parent authority. But however, I can share that approximately 40% of our enrolled clients at OSC Center and Drug Treatment Center, NHAK, consists of uniformed personnel and students. So I can speculate that these numbers are consistent across all the other 56 OSC centers and satellite outlets in our state. And that is the highest number of OSC centers and satellite centers in our nation. And I think this corresponds to what Sir said earlier regarding the 111,000 school-going children or college students using substances. These therapies are administered as outpatient treatments, and it requires months to years for completion, and it may not be suitable for individuals seeking rapid intervention. Presently, there is a significant imbalance between the number of individuals seeking quick medical intervention for substance use disorders, of course, and the availability of detox and rehabilitation facilities in our state. Most detox centers are affiliated with district hospitals, and while rehab centers are typically managed by the NGOs. So from that you can guess there are very few number of districts, district hospitals compared to the 1 lakh individuals. That is also just students, right? So now think about the general population, the other, like let's say the uniformed personnel, maybe those who are uneducated. So there's a great disparity between the number of people seeking treatment and the number of detox facilities that we have.
So can you please highlight on the challenges that, as you have said, that number of detox facilities are less in comparison to the numbers of abusers or users for that matter. So what are the challenges that
one of the most challenging aspect of detoxification and rehabilitation is the misconceptions that the parents or the family hold on to. I've experienced quite a number of, including the user himself. Many a times they think that they are just addicted to that substance, but it is not. In fact, they are addicted to what the substance do to their brain rather than the substance in itself, and they don't understand that. So they have the notion that, I'll take this opiate substitution therapy for 2 weeks and I'll be alright. They say like, no, I'm going to detox for a week and I'll be alright. I don't need further psychosocial counseling. I don't need further stay in rehabilitation centers or prayer centers. Or maybe some of the parents, like I've said about misconception earlier, they have the opinion that, let me quote and unquote, "Mula mota to ek hafta prayer center rakideli pal hui jao." That's what they said to me, and I have to dispel the misconception. And sometimes it's very hard to change a person's beliefs and thinking. So that's one of the challenges that we face every day at our centers.
Do you think this is due to lack of awareness or lack of activities from the department end? Department does. I don't necessarily mean just the health and family welfare, but do you think this is what do you think is the main cause of this general misconception?
I think all the departments are working together. They have been working together, but then I feel we need to do more. And especially today we are here about how aware are we. So by my experience, I can appreciate there's a lot of lack in awareness. So I think again we should have awareness programs wherein we should focus on the quality of information provided in the awareness programs and also in the quantity, but then the quality of information I feel is very important, and then a lot of us are lagging behind, including the parents or family members. Like you have asked earlier, is there any sensitization program being held for parents? So I feel such programs we will be benefited from such programs.
I think I also agree. Quality information is really important. Many a times manubishi ki jama kuri da information ki diya se just for the sake of organizing a program kuri the. But even our evangelist has also mentioned that ekjun manu bhalra bujishugule more than 5 people ke taibi luina hi jai. So I think that is something that we all need to explore more. We need to work on it. So coming back to the collaborative programs that, as you have mentioned, you have done with a lot of departments, line departments, is it successful to some extent?
Okay, before we talk about whether it is successful or not, because we don't have a measuring stick for that what we do today will be shown on paper maybe after 10 years during a national survey. But let me tell you about the collaboration that has been done so far. Actually, the fight against drug has been ongoing since the beginning of our statehood. Actually, we can appreciate it by the police department. They are manning our borders to reduce the number of drug influx in our state, because most of the drugs that we use or that are being abused in our state is not locally made. It is being transported outside of our state. So this is what the police are working on, that is supply reduction. Churches, schools and colleges, the health department, they are creating awareness programs so that the students or the individuals, they don't take or they don't misuse the drug. So this is the aim of that program, is to reduce the supply. And then we have NGOs and then health department in particular. We have detox facilities, treatment centers, free needle exchange programs, or free condom distributions. These are all aimed at reducing the harm. So from there's a program for supply reduction, there's a supply for demand reduction, and then we are doing harm reduction. But I feel we need to do more. Successful, I won't be able to tell you how successful it is, but I will be able to tell you a collaboration done by the AIDS Control Society in our state. They have a very comprehensive program regarding harm reduction. First of all the clients, they get tested for HIV and hepatitis, and then if they are positive, then they are given free treatment at the ART Plus Center, and then the National Virus Hepatitis Program, and then all the clients are again connected to targeted intervention groups. They are operated by the NGOs, so they ensure monitoring of the clients and then of their well-being and also address their needs. Then the OSC centers, they give substitution therapies and counseling to all the registered clients. This program is currently operational in all the districts, and it is provided at no cost, so everything is free. Again, another program that we try to do, we collaborate, is the detox facility in NHAK, where we offer medically supervised detoxification followed by psychotherapy. Then upon discharge, we also invite the patients to participate in daycare rehab facility such as Project Rest. So these are some of the collaborations, but then like I said, the success won't be measured today.
Aftermath and effects, we are experiencing only now what has been done, the damage that was done I think 5-10 years ago. Similarly, the good work we kwanchna in the days to come. Sir, as you have mentioned that a huge alarming number of students are being influenced or are addicted to drugs. So what, according to the department, is the main cause of the rising drug users among children?
Actually, there are so many factors contributing to drugs abuse among the school-going children. Usually, the main cause should be peer-to-peer pressure, and then in one form or the other, mostly should be some psychological traumas, mental health issues, and then poverty also plays a very important role, which aggravates the situation. And usually, it starts from the family itself. So there should be proper education, open discussions in the families regarding the abuse of drugs, which is not that present, not so prevalent in our society, because the family itself is a unit from where all this trouble starts. So in the family itself, there should be open discussions about the harmful effects of drugs, and there should be strict rules laid down about consequences of drugs. Ito apni drugs khali ito hoy pachagi ko lagi, and try to develop healthy living habits or healthy habits as an alternative to drugs, so that the school-going children or those are the vulnerable groups, they don't get into drugs. So all these factors are there. So
I think I would like to supplement Sir's point of view. Yes, parents should actively engage in the children's lives, because in our center we can see firsthand that drug use or alcoholism is almost hereditary, not because of genetics but because of the environment that they are living in. And if the parents, if they are abusing any substance or drugs, it's very likely that the children, they are going to use drugs. So I think parents should change themselves first, then bring about change in their children as well.
All agencies of our society, our social structure is working towards fighting drug abuse, but I think it all comes down to the family as well. It is where the solution as well as the problem arises. So my next question is for the three of you. What are the main challenges that your particular organization faces when it comes to dealing with drug abuse or drug related issues?
I think I have mentioned earlier, so I think I'll give
one thing that the medical side faces is misconception, late intervention. So
the challenges is about recovery day will कोशिश करो. Will be चाहिए ना family environment दे just को will be shit दिखता है भाई. So they struggle a lot. And sometimes the family misunderstand them. Trust factor तो हराई ना आज तो in relationship. तो ताइकान चाहिए ना recovery day. ताकि कि ना चाबुली ना पड़ा तो shit family लोगों educate को बोले recovery ये जाने नहीं किन्हीं को तो shit तो पाए. और आजकल लगा इतना तो for example मुद्दू का ऐसे तो मुद्दू का तो boost train दी बिशी पक खाई तकी से. बिल्ली भी आजकल तो खोड़ी आने की ना इतला खाई तकी. तो ताइकान लोगों reach out को बोले तो किन्हीं के भी reach out नकोरे. अम्मा बाबा कान प्रॉब्लम नकोरे, माइकी प्रॉब्लम किसी को तो नकोरे. To the time they can reach out globally, they can inigasi moto kurul lakado na parang na dito lang challenges kita amihan pa dito itia amihan to sa dito kasi ika amihan kurang dito ka moto kurul mo na siya na parang na ito
Regarding the church, I just want our listeners to know is there, what are the steps kiniga ito services that is being provided at Kaba kiniga avail koribo? Is there a helpline? What are the procedures? If you can, listeners wish it hagibo I will monjai they might be encouraged also. So how do they approach?
American politin di ulai thake American journals ulai thake to tadi helpline likhina helpline in the sense pastor laka number dibo evangelist laka number dibo or American laka kunbra recurring kunbra motak probably pare to laka American need dispatch ko thake phone number no tunishina ko thake or colony pastors especially it's for we now it's more confined with our kapa so colony pastors kan thake contact person do they can connect with people and reach out to tunishina ko thake or leaders kan tunishina American they can contact thake na they can American ko American wahi na motor mani thake American parada tunishina motor ko thake.
So just approaching the church, ikla church nili pastor ke approach kar libe hoy jabo. We are running out of time. Na jani nai time khatam hui jaise. So in your own words, final message apni khan to our listeners kina develop. Let's with Dr. Chuba.
First, I'll just get back to this individual himself. So in order to stay away from drugs, educate oneself, and based on the education information you get, try to avoid drug use. Basing on those knowledge, try to be role models for your younger peers who are younger than you. Try to be role models, and so that some sense of responsibility is imbibed into them not to get into drugs. That's one advice to every school kids or any young person for that matter.
Thank you so much. Any message to our listeners?
Addiction di takishi bule do recover kore help bisai bule jani bulage to kwani sina osori hospital tagibo doctor kan go jagina motor mangibe churches kan especially American ini church leaders kan do jani na ase takan go motor mangibe motor kurbo abni it's never too late recovery de hai bule to abni helplessness na hopelessness na tagibe ishor robi morung re ase to sina help besides you do apni pai jao.
It is very important for us to know that addiction is a medical condition, not a moral failing. So please seek help early, prioritize your mental health, and remember that recovery is a journey, not a destination. And then we need a lot of collaboration between different agencies because it takes a village. So we need to actively engage in community initiatives. We need to support each other, and we need to foster an environment of empathy and inclusion. So together we can overcome this challenge of drug abuse.
Thank you so much. Thank you so much for your wonderful messages. At the end of the day, there is help all around you. All you have to do is, raise your hands and seek for help. We had a really interesting session with Dr. Sungtimen, who was here earlier also and who consented to be here even today. He is the Nodal Officer, Project REST, NHAK. Thank you so much, Doctor, for being with us.
Thank you.
We also had in our studio Dr. Chubanungsang, Joint Director, School Education Department. Thank you, sir. And Mr. Imosanen, Evangelist, Kaba. Thank you so much for being with us. And with that, we come to the end of our program here. But let me quickly remind you once again that, dear listeners, you can inform or you can register any person who is a trafficker, transporter, or peddler of sunflower drug at Meet in app or WhatsApp at 690-90-20229. 690-90-20229. Let me say it once again. 6909020229. You can apni khan register korle parbo or kwanishna apni la identity to secret thakibo, anonymous thakibo, and you will receive a cash reward of rupees 1,000 per soap case. So be a responsible citizen and register, be informed, and use the facility that is made available for you, Made in app Cholaole Parwa, and you can also use Call My Cop app. With that, we come to the end of our program. Thank you so much all for tuning in.